speaking about the identification of viruses. This will be a first session. I'm going to cover virology in this. Of parasitology, because parasitology I will take little detail. Okay. So identification is what it is based on of virus. Identification of virus is based on CPE, that is cytopathic effect, and also inclusion factor. So cytopathic effect क्या होता है? Cytopathic effect is how it is affecting the cells. Okay. Whether it is causing clustering, so if it is causing clustering, that is seen in adenovirus. If it causes large lysis, then it is seen in poliovirus. Poliovirus is called large lysis, clustering adenovirus. Sensation is by respiratory syncytial virus or measles or HIV. The respiratory syncytial virus, measles and HIV. Even parainfluenza type 1 virus also causes sensation. So it is respiratory syncytial virus, measles virus and HIV virus and parainfluenza type 1. Then ballooning of the cells. Whether the cells of an organism, they are going to undergo ballooning or not. So ballooning is in the same cytomegalovirus. That is what I have so far read. Focal degeneration will be seen in herpes virus. Focal degeneration क्या होता है? Focal degeneration is clustering is the adenovirus. Clustering adenovirus. Lysis polio, syncytia by RSV, measles, HIV, and parainfluenza. Ballooning of cells is by CMV. Focal degeneration is by herpes virus. इसमें क्या होता है? Multi-nucleated giant cells होता है. So they will be used. Syncytium is multi-nucleated and focal degeneration में herpes virus में multi-nucleated giant cells होता है. Okay. That causes में focal degeneration देखने को मिलता है. Influenza A जो है, it is good in heme absorption but no sensation formation. So parainfluenza में तो हमने बात कर ली. Influenza A जो है, it is good in heme absorption. What is heme absorption? So heme absorption is like iron absorption. So it is good in heme absorption but there is no sensation formation. फिर आता है हमारे पास inclusion bodies. Inclusion bodies could be intracytoplasmic or intranuclear. Okay, so intracytoplasmic inclusion bodies कौन सी हैं? Intranuclear bodies कौन से? So intracytoplasmic में you have neighboring bodies that is seen in rabies. Intracytoplasmic neighboring bodies in rabies. Pasчин bodies are seen in variola. Guarneri bodies are seen in bacteria, and Bollingers, they are seen in fowlpox. Okay, HP bodies are Henderson, Peterson bodies, they are seen in mollusca contagious. So Negri bodies are seen in what? Rabies. Pasчин bodies are seen in variola. Guarneri bodies are seen in bacteria. Bollinger is seen in fowlpox. HP bodies are Henderson, Peterson bodies of mollusca. Negri rabies, Pasчин variola, Guarneri bacteria, Bollinger fowlpox, and HP Henderson, Peterson bodies mollusca contagious. फिर हम बात करते हैं इंट्रान्यूक्लियर बॉडीज. ओके, इंट्रान्यूक्लियर बॉडीज जो होती है intranuclear bodies can be Cowdry A or Cowdry B. Cowdry A bodies are seen in herpes. Okay, herpes have lip shoes, is also called as lip shoes, yellow fever, Taurus, then even in varicella. All acidophiles have this. Cowdry A means the bodies are all acidophilic and cowdry B will be basophilic except polio. So polio is not basophilic. Cowdry B is seen in adenovirus, cytomegalovirus and also in polio. Both intracytoplasmic and intranuclear bodies donor. They are seen in measles as well as in CF. Moving on to herpes virus. This was all about the general properties of the virus. Moving on to herpes virus. So let me see herpes virus is category out there so that we can see herpes virus 466. Now herpes viruses. herpes viruses जो होते हैं इनका clinical case दिया है. A 25-year-old woman presented with complaints of genital blisters for the previous 7 days and fever and headache and vomiting for the previous 2 days. On examination, she was found to have neck rigidity and a lumbar puncture was performed for CSF examination. The CSF was clear with a cell count of 100 cells per millimeter cube. Lymphocytes were predominant. Remember, in viral meningitis, it is always the lymphocytes that are going to be predominant. CSF glucose was normal. See, glucose is also not less. And the proteins are slightly elevated. The CSF was inoculated into the berry cell lines in the laboratory, and the PCR test was positive for herpes type 2 DNA. The patient was started on treatment with ganciclovir. Supportive treatment was also provided and the patient responded. So a supportive treatment was also provided here. She was advised to recount this history to her doctor at any future pregnancy. So she should tell the doctor that she had suffered herpes like this if she desires pregnancy. Now, going on to the description of this. See, herpes virus is a double-stranded DNA virus and it is enveloped. It has an icosahedral symmetry. Latency is alpha, beta, and gamma. That is alpha ganglion. The beta secretory glands में होगी and in gamma lymphoid tissue. Okay. Now types HSV1, HSV2. Okay, HSV1 is HHV1. HSV2 is now HHV2. HHV3 is actually varicella zoster virus. HHV4 is Epstein-Barr virus, and HHV5 is cytomegalovirus. HHV6 is simply HV6. HHV7 is actually HV7 simply. HHV8 is actually Kaposi's sarcoma virus. New name is actually HHV. Now we don't use the old name, so Epstein-Barr was old. The HHV1 virus and HHV2 virus, out of these two, HHV2 is more resistant and it is more neuron virulent. More neurovirulent. So it is resistant more and it is also virulent more. and it causes infections below the waist, whereas it differs from HHV1 in these periods. Like HHV1 is not that resistant and it is not that virulent because it doesn't cause infections below the waist. HHV2 does that. Skin. On the skin there is blister, and these are called as herpetic ulcers. They form erythema multiforme, then herpetic whitlow भी कहते हैं इसको, herpetic keratitis और congenital infections. Okay, all these can be there. Meningitis, aseptic meningitis is seen and it is common with HHV1, though HHV2 is more virulent. And it is this kind of meningitis is also called as mollaret meningitis. Okay, and it can also cause encephalitis. So encephalitis can also occur. Diagnosis. Diagnosis of this is by ELISA and PCR. A Zank smear is made and it will reveal multinucleated giant cells. Treatment is by acyclovir. Zank cells क्या करते हैं? Zank smear is produced that will reveal multinucleated giant cells. So remember, Zank smear is for herpes virus. Treatment is by acyclovir. Now HHV3 or varicella zoster virus. It causes both varicella, that is a chickenpox, first, and then the reactivation is going to cause shingles, that is actually zoster. Varicella is transmission of varicella is through droplet. Okay, there is a rash that appears first on the tongue and then to the limbs. The rash will be a pleomorphic rash. It is going to appear 2 days before the appearance of rash and 4 to 5 days after the appearance of rash. The patient is able to transmit the infection. So 2 days before and 4 to 5 days after the appearance of rash. Complications of varicella, most common is secondary bacterial skin infections. There can be other bacterial skin infections, and the most fatal is actually varicella pneumonia. So that is why this kind of picture is there in people's mind that after getting chickenpox, a person might have pneumonia. Now, what is the vaccine available? The vaccine available is the OCA strain or varicella zoster IG. So vaccine available is OCA. OCA strain vaccine is the vaccine that is available. OCA strain and VZ immunoglobulin. In immunocompromised state, acyclovir can also be given. Zoster is reactivation of chickenpox. It affects a single dermatome. Generally, T3 to L3 is the dermatome that it affects. That is why you see a characteristic lesion in the patient on the side and also above the nipple area, because the level of nipple is at the level of T4. So T3 to L3 is the dermatome. It is associated with Ramsay-Hunt syndrome. Okay, and Ramsay-Hunt syndrome, and there will be Bell's palsy and there will be blisters. Now, blisters can be in the external auditory meatus, it can be in the tympanic membrane, or it can be in the tongue. So, blisters can be in the tongue, it can be in the tympanic membrane, or it can be in the external auditory meatus. कहीं पे भी blisters आपको मिल सकते हैं patient में. फिर आता है हमारे पास HHV8 और cytomegalovirus. It is the largest herpes virus, इसीलिए megalo कहते हैं. It has owl-eye appearance. Most common cause of transplant transmitted infections among renal transplant recipients within 6 months due to cytomegalovirus. Beyond 6 months, it should be BK virus. It causes cytomegalovirus retinitis, congenital infections, and also bloody diarrhea and pneumonia. Diagnosis is by ELISA and again by PCR. PP65 antigen reaction. It is a special reaction in ELISA. Treatment is by phosphoramate and Gansett. So this is the method of treatment. PP65 antigen reaction. PP65 antigen reaction is a special reaction. Where is it seen? It is seen in ELISA. Treatment is by phosphoramate and Gansett. Phosphoramate and Gansett will treat this. PP65 antigen is a special reaction in ELISA that can be seen or that is detectable in cytomegalovirus. Then comes HHV4 and Epstein-Barr virus. HHV4 and Epstein-Barr virus की बात करते हैं. What is the target? It targets CD21 or CR2 on the surface of B cells. So, what is the main target of HHV4 and Epstein-Barr virus? It is going to target CD21 and CR2 on the surface of B cells. It leads to Burkitt lymphoma, Hodgkin or non-Hodgkin lymphoma, nasopharyngeal carcinoma in Chinese people. It can lead to oral hairy leukoplakia, infectious mononucleosis or kissing disease. So all these things it can take place. It can lead to it. What is it going to target? It is going to target CD21 and CR2 on the surface of B cells. CR2 is present on the surface of B cells, so that will be targeted, and CD21 will be the targets for this. Now, how are you going to diagnose it? The diagnosis is by ELISA PCR. Paul Bunnell test is done. इसमें क्या होती है? Antibodies होती हैं, which are against Epstein-Barr virus and also She-Barr disease. So, Paul Bunnell test में antibodies are produced against Epstein-Barr virus and also against the RBCs of the sheep. And on the same lines, there is a test known as the monospot test. Okay, antibodies are actually Epstein-Barr virus producing, or antibodies are going to be for horse RBCs. So, ELISA PCR, Paul Bunnell test. Okay, antibodies, Epstein-Barr virus, She-Barr disease. In the same lines, there is a test, monospot test. इसमें antibodies, Epstein-Barr virus और horse RBCs. ये था हमारा. We talked about ELISA, PCR, etc. अब हम क्या करेंगे? HHV6. What is HHV6? HHV6 is actually sixth disease. इसको हम sixth disease भी कहते हैं. Fifth disease and sixth disease. And exanthum subitum and roseola infantum. All this will be seen in this. Now talking about another category of virus, but before that, I'm quickly going to flip through the pages of herpes virus. See, Icosa heterosymmetry, capsid tegment, all of them. This is a vervet monkey kidney cells or viro cell line uninfected, and vervet monkey kidney cell viro cell line infected with herpes simplex virus. Note the rounded cells and the giant cell formation. This is a fever blister. These are the herpes virus in a Zank smear से multinucleated giant cell जैसा लग रहा है. Varicella zoster virus, for this we have a case here. 50-year-old HIV positive man developed vesicular eruption on the right side of the spine in the lumbar region, which was very painful. Scrapings from the base of the lesion were positive for the varicella zoster antigen by direct fluorescent antibody test. A culture from the fluid was inoculated on the cell lines and the PCR test was positive for varicella zoster virus. The patient was treated with acyclovir. On further inquiry, the patient revealed to the doctor that he had had chickenpox in childhood. So this is what was uh, this is what we were talking about. Now here is a case for cytomegalovirus as well. A 25-year-old man diagnosed with HIV and AIDS presented with a complaint of diminishing vision, which has been slowly progressive for the previous 3 months. His CD4 counts at the time of presentation were less than 100 cells per milliliter. On fundus examination, retinal infiltrates which were fluffy in nature were found, along with the presence of multiple hemorrhages. Serological tests were positive for cytomegalovirus. So there were presence of multiple hemorrhages. So along with multiple hemorrhages, we found what serological tests. Serological tests किसके लिए positive है? The serological tests were positive for cytomegalovirus. IgG antibodies and PCR on the blood was positive. So IgG antibodies और PCR जो होता है वो हमने ब्लड में किया and it was positive for cytomegalovirus का DNA. जो cytomegalovirus का DNA है उसके लिए this IgG was positive. IM-PCR on the blood was positive for this. Patient was diagnosed with cytomegalovirus का retinitis and treatment with ganciclovir was started. Further investigation revealed that the patient had not been taking his anti-HIV treatment regularly, so he was advised to do so again. Subsequently, there was no further deterioration in the symptoms. So this was about symptoms. See, this is H&E stained lung tissue showing owl's eye like inclusions of cytomegalovirus 1000. This is the cytomegalovirus infected cell. Talking about Epstein-Barr virus. A 16-year-old girl presented with complaints of malaise and loss of appetite for the previous month and sore throat and fever of 40 degrees Celsius with a rise in temperature, especially in the afternoon for the previous 5 days. On examination, cervical lymphadenopathy and mild hepatosplenomegaly were detected. In complete blood counts, that is CBC, she was found to have absolute mononuclear lymphocytosis, with most of the lymphocytes being atypical lymphocytes seen. Her serum tested positive for Paul Bunyan test. Her IgM was also positive for Epstein-Barr virus and AIDS. Then the patient improved on supportive care. So this female was having infectious mononucleosis, Kissing's disease. Clinical and immunovirological events in Epstein-Barr virus. Clinical features: incubation period of 4 to 7 weeks, glandular fever, sore throat, anorexia, lethargy, lymphadenopathy, hepatitis, splenomegaly, and cofactors, so uncommon or late tumors. Epstein-Barr virus infection, oropharyngeal epithelium में virus shedding in the saliva continues often for months after recovery and nasopharyngeal carcinoma भी हो जाता है. Local B cells में spread via blood, liver, and lymph nodes or spleen. वहाँ से more B cells, वहाँ से restricted infection, no lysis. Epstein-Barr virus DNA becomes latent in circulating B cells and causes reactivation. Example in post-renal transplant. Polyclonal activation-based IgG levels and immortalization, that is indefinite B cell proliferation. Lymphoma, play or Burkitt lymphoma. Burkitt lymphoma will be seen in Africa and lymphoma in immunocompromised. Immune response जो होता है वो T cells का होता है या antibodies का होता है. They destroy the infected B cells gradually and clear the infection. Immunopathology, that is lymphadenopathy, etc. and symptoms probably due to the cytokine release. Then we are going to talk about human herpes virus type 6, 7 and 8. इसमें तो कुछ ऐसा दिया नहीं है. Herpes virus, senior or B virus. What is it? These finishes are herpes. Coming on to adenovirus. Adenovirus has a spaceship appearance that you will see. Paracoccidiosis can mainly have spaceship appearance. Paracoccidiosis can. Adenovirus had a spaceship. So we have a case over here for adenovirus. During the monsoon period, 10 students from boarding school presented with irritation and redness in the eyes along with mild fever. So 10 students, monsoons के time पे 10 students from a boarding school, they came up with such issues or such problems. Okay. During monsoon period, 10 students from boarding school presented with irritation and redness of the eyes along with mild fever and sore throat. Mild fever है और sore throat की problem है. Irritation and redness in the eyes along with mild fever and sore throat. 3 of them had severe pain in the eye with excessive watering from the eyes, and corneal ulcers are also found. Conjunctival swabs were collected for viral examination. Direct smear examination by indirect immunofluorescent assay was positive for adenovirus type 8 antibody. Adenovirus type 8 antibody. 5. PCR was also positive for adenovirus type 8 in all the students. Supportive therapy was given for corneal ulcers, and the students of the conjunctivitis group responded in 8 days, while the corneal ulcers took 3 weeks to heal. Corneal ulcers took 3 weeks to heal. Children were advised precautionary isolation and further spread was unknown. So now going for the theory of this. See, adenovirus is a double-stranded DNA virus. It is non-enveloped. Okay. It is non-enveloped virus. Then typical spaceship appearance होता है इसका. It causes epidemic keratoconjunctivitis, तो वही हुआ था अभी बच्चों को. That is caused by 8 and 19 and 37. 8, 19, 37 species में उन्होंने epidemic keratoconjunctivitis caused किया. It is also known as shipyard disease. इसको हम shipyard disease भी कहते हैं. Then swimming pool conjunctivitis. Swimming pool conjunctivitis is also by chlamydia, but swimming pool conjunctivitis is by chlamydia. Shipyard is this. Pharyngoconjunctival fever जो है pharynx and conjunctival fever 347. Hemorrhagic cystitis is by 11 and 21. 11-21. Infantile diarrhea is by 40-41. And treatment and diagnosis is by ELISA and PCR. So based on that. Vaccine is given. It is live vaccine for 4 to 7. Uh, and it is tablet based. I don't know what is this. So that is what is all about adenovirus. This is the adenovirus. Diarrhea, shipyard, follicular or swimming pool conjunctivitis is by 3-7. Moving on to parvovirus. Unfortunately, there is no case for parvovirus, so we will be studying it just like that. Parvovirus is a single-stranded DNA virus. Okay. Causes fifth disease or erythema infectiosum. B19 subtype causes fetus or fetus hydrops, most common. It destroys the erythroid precursors, causing aplastic crisis. It is going to cause chronic granulomatous disease. In children, it causes slab cheek appearance. In adults, it causes polyarthritis. So it causes polyarthritis in adults. And in sickle cell patients, it can cause aplastic crisis. So aplastic crisis in the patients of sickle cell anemia. Now, human papilloma virus. Human papilloma virus जो होता है, it is a double-stranded DNA virus. Okay, now we are going to look at human papilloma virus. इसका भी कोई वो नहीं दिया हुआ है जो इसने नहीं दिया. It is also a double-stranded DNA virus. It is non-enveloped, enveloped नहीं है. It has icosahedral symmetry and there are many serotypes. One causes plantar wart. 2, 3 and 5 it causes common wart. And 6 and 11 causes condyloma acuminata, not lata. Then laryngeal papilloma भी यही cause करता है and anorectal warts भी यही cause करता है. 16, 18, 31 और 33 ये human cervical cancer cause करते हैं. Human cervical cancer. Okay. So they cause human cervical cancer. Bivalent vaccine is Cerevarex. It is having 16 and 18. Right. Quadrivalent vaccine is actually Gardasil. Gardasil actually. 6, 11 or 16 and 18. And nanovalent vaccine. Nanovalent vaccine जो है वो किसकी है? Just a second. Okay. Nanovalent vaccine is Gardasil 9. It is 6, 11, 16, 18, 31, 33, 45, 52, and 58. Currently, this is used. Then comes influenza virus. Influenza virus तो क्या होता है? इन्फ्लुएंजा वायरस एक अलग ही वायरस है. अच्छा वो कार्डासिल जो है वो 6, 11, 16, 18, 31, 33, 45, 52 and 58. 42, 45, 52 and 58. I'm going to talk about influenza virus. इन्फ्लुएंजा वायरस का लकीली केस है हमारे पास. Okay. A 60-year-old woman from an old age home complained of headache, myalgia, and pain in the eyes during winters. She had a history of chronic obstructive airway disease and had never been vaccinated for influenza. She also complained of severe pain in the throat and also runny nose. After 3 to 4 days of these symptoms, she developed cough and fever of 39 degrees Celsius. Cough or fever develop हो जाता है. Her fever and cough showed rapid progression and later she had dyspnea. Fever and cough showed rapid progression. The fever rapidly progressed and later she had dyspnea. The blood gas analysis was consistent with hypoxia and her chest X-ray showed bilateral signs that are diagnostic of adult respiratory distress symptoms. Okay. Her sputum and nasopharyngeal aspirate tested negative for bacteria. PCR was positive for influenza virus H1N1 swine flu. She died despite supportive care and antiviral therapy with oseltamivir. So now talking about influenza virus. Influenza is a single-stranded RNA virus with a negative sense. It is also segmented and enveloped virus. It has helical symmetry. It will be A, B, C. These are the types. A, influenza is responsible for most of the pandemics. B is responsible for epidemics. And epidemics only amongst humans, and C is for sporadic cases. So hemagglutinin is H15. It causes entry of the virus. Vaccine is going to act on this hemagglutinin component and prevents the entry, H15. And neuraminidase N9. It is receptor destroying enzyme. It causes elution. That is, it masks the RBCs free from the viruses. Antigen on the surface of influenza virus. Now Magnus phenomena क्या होता है? Magnus phenomena is increase in HA and decrease in infectivity. अगर हीम एग्लूटिनेशन बढ़ता है तो infectivity कम हो जाएगी. Because of this, the virus undergoes reassortment, and there is something called as genetic drift and genetic shift. If there is genetic drift, drift का मतलब क्या है? थोड़ा सा होना, ठीक है? It is slow, it is periodical, and it is mild. एंड बट शिफ्ट जो है वो तो एकदम से हो जाएगी और बहुत ज़्यादा होगी. सो दैट इज सिवियर, अब्रप्ट एंड ऑल्सो नॉन पीरियोडिक, देयरफॉर इट कॉजेस पैंडेमिक्स. लैब डायग्नोसिस इज ऑफ दिस इज ELISA PCR. Treatment is oseltamivir and zanamivir. Vaccine is live attenuated vaccine that is available in the form of nasal spray. Live attenuated vaccine. Killed vaccine is available, and that is available by intramuscular route. Then we have poliovirus. I'm reading a case of poliovirus. A 10-year-old boy from a labor colony presented to the emergency department with history of mild fever and sore throat for the previous 8 days. The history of what? Mild fever and sore throat for the previous 8 days. Okay. 10 साल का बच्चा है फ्रॉम लेबर कॉलोनी प्रेजेंटेड टू द emergency department with history of mild fever, very mild fever and sore throat. There is sore throat also. Mild fever, sore throat for the previous 8 days. Previous 8 days, 8 दिन से उसको ये बता दिया. It became severe and was accompanied by neck rigidity and vomiting for the previous 2 days. Okay, so a 10-year-old boy from labor colony presented to the emergency department with history of mild fever, sore throat for the previous 8 days, which became severe and was accompanied by neck rigidity and vomiting for the previous 2 days. After a brief symptomatic period of 2 days, on the morning of presentation, he experienced pain in the right lower limb, which increased and progressed to weakness at the time of presentation. Increase and progress to weakness at the time of presentation. His mother had no recollection of any vaccine given to the child during the first 5 years of life. Throat swab, stool specimen, and CSF were sent for viral studies. Throat swab and stool specimen tested positive for cytopathic effect in the tissues culture, and the virus was confirmed as poliovirus type 1 on the neutralization test. Okay. Reverse transcriptase PCR in CSF was positive for the poliovirus. The patient improved on supportive treatment. Okay. So reverse transcriptase or RT-PCR was positive for polio. Patient improved on supportive treatment. The supportive treatment से patient improved. So poliovirus के क्या what is the cytopathic effect in poliovirus that we studied in the beginning? Large lysis. Talking about the theory, it is non-enveloped, double-stranded RNA virus है. RNA virus है, it is double-stranded RNA virus, but with a positive sense. We have icosahedral symmetry. The types are paralytic polio. It is not in India since 1999. Type 1 causes paralytic polio. Type 2 is not found in India since 1999, and type 3 is actually the polio vaccine. Type 3 is polio vaccine. बनाने के लिए जो होता है वो type 3. Okay. तो ये था. Now, what is the important antigen? Important antigen over here is the dense antigen or D antigen. इसमें D antigen जो हमको शायद पॉजिटिव मिलता है. ट्रांसमिशन इज थ्रू फीको ओरल रूट. फीको ओरल रूट से इस वायरस का ट्रांसमिशन होता है. What are the complications? Okay, the complications are less than 1% complications are CNS complications and less than 0.1% are actually paralytic poliomyelitis. Less than 1 is what? CNS complication. And less than 0.1 is paralytic poliomyelitis. Paralytic poliomyelitis and Less than 1 is CNS complication and less than 0.1 is paralytic poliomyelitis. Less than 1 is CNS complication, less than 0.1 is paralytic poliomyelitis. ठीक है ये? Less than 1 CNS complications or less than 0.1 is paralytic poliomyelitis. So CNS complications are common. Now IPV or killed vaccine OPV is OPV को सेवन कहते हैं, that is live and attenuated. IPV is killed vaccine जिसको हम सॉल्व वैक्सीन कहते हैं. तो लोकल इम्यूनिटी इन द गट जो है वो OPV से आती है, that is सेवन. तो ओरल गट कहाँ से स्टार्ट होता है? गट स्टार्ट फ्रॉम द ओरल कैविटी itself. ठीक, तो ओरल से ओरल ओपीवी से गट, सो लोकल इम्यूनिटी इन गट. हर्ड इम्यूनिटी भी हमको ओपीवी देता है. एंड इन immunocompromised patients we should not be giving any live vaccine even if attenuated, because आप चाहे जितना भी attenuate कर दो, लाइव वैक्सीन अगर दोगे सो देयर आर चांसेस कि जो वो पेशेंट है उसको वो डिजीज कॉज करेगा या दिक्कतें होगी. Killed vaccine is IPV or killed self vaccine that is given और वो positive होती है. Okay, so OPV is going to change into IPV and OPV again. So OPV में type 1, type 2, type 3 वो ट्राइवेलेंट थी, फिर वो बाइवेलेंट हो गई. बाइवेलेंट या डाइवेलेंट, उसमें 2 को हमने यूज़ करना बंद कर दिया, 1 और 3 यूज़ किया. उसके बाद हम OPV से सीधा IPV पे आ गए. IPV और OPV प्लस मतलब दोनों को साथ में लेना स्टार्ट कर दिया. IPV alone is not used because persons immunized with IPV can still become infected and they can shed wild type of poliovirus. इसीलिए हमने IPV अकेले लेना बंद कर दिया. Then McBride marker is the safety marker of vaccine for OPV. OPV vaccine के लिए there is a marker, McBride marker. This McBride marker is a safety marker of vaccine for OPV. फिर आते हैं रेबीज पे. रेबीज वायरस पे जाने से पहले I am going to look for any case history if present. So there are 2 cases for rabies, case 1 and case 2. Okay. और इसमें पोलियो में और कुछ, पोलियो वायरस में दिस इज द न्यूक्लिक वायरस, दिस इज द वायरस विद रिसेप्टर्स. ये डोमेन्स हैं 1, 2 and 3. और तो कुछ दिया नहीं इसमें. सीरम and secretory antibodies responds to 3 doses of OPV or 3 doses of IPV दिया गया है बस. IPV OPV में डिफरेंसेस बताए गए हैं. Yes, and nothing more than that. Quickly coming over to rabies virus. Clinical case 1. A 5-year-old boy was bitten by a rabid dog. 5 साल का बच्चा है, उसको एक रेबीज हुए कुत्ते ने काट लिया, that is rabid dog. And presented to the emergency department with multiple scratches on the upper arms and the neck. So 5-year-old boy है, he was bitten by a rabid dog and he presented to the emergency department with multiple scratches on the upper arms and the neck. 5 साल का बच्चा, he was bitten by a rabid dog, presented to the emergency department with multiple scratches on the upper arms and also on the neck. So upper arm और neck में बहुत से scratches हैं. The parents stated that the dog was a stray, present most of the time in their area, so he could be observed. The child was given local wound toileting, okay, followed by application of povidone iodine. The wound was left open. He was given tetanus toxoid as his booster was due, and the viroculture vaccine was started. He completed the course of 0, 3, 7, 14, and 28 days post exposure, as the dog died 2 days later. So he completed the course of 0 days, 3 days, 7 days, 14, and 28 days post exposure. The dog died 2 days later. His brain was sent to the veterinary lab and tested positive for neighboring bodies and histopathology. So this was one phenomenon. Another case is a 30-year-old woman was brought to a referral hospital from a rural area where she was admitted with fever, anorexia, and vomiting for the previous 4 days. Okay. 30-year-old woman was brought to the referral hospital from a rural area where she was admitted with fever, anorexia, and vomiting for the previous 4 days. However, she became delirious and developed hallucinations and was started on supportive therapy in the hospital pending laboratory results. Okay, 30 साल की woman है, fever, anorexia, and vomiting for the 4 days. She became delirious and developed hallucinations and was started on supportive therapy in the hospital pending laboratory results. On inquiry, her relatives informed the doctor that she used to go out to collect firewood and that she had been bitten by a stray dog about 3 months previously. No medical help was sought at that time and only some local treatment was given for wound care. However, the next day she developed severe spasm in the pharyngeal muscles in an attempt to drink water. This spasm increased in intensity and distribution, leading to generalized convulsions. She died during one of these attacks due to respiratory failure. Post-mortem was conducted and the brain tissue was found positive for rabies virus antigen by direct fluorescent antibody test. Okay. So this was all about the rhabdovirus. Post-mortem was conducted, brain tissue was found to be positive for rabies virus antigen by direct fluorescent antibody test. So now beginning with the virus. Rabies virus is a bullet-shaped virus. It has single-stranded RNA and it is negative seeds, helical symmetry, and it is enveloped. Okay, uh, helical symmetry. So, a patient with CCF was one of the method of remembering helical symmetry. The street virus, MRF bat, was also opposed. The MRF bat and my boyfriend is rich. ये दो मेकानिक्स इसके याद करने का तरीका उसमें जो बाहर से आता है दैट इज रेबीज. Street virus are fixed. Street virus is freshly isolated virus. Freshly virus का isolated that is freshly isolated virus is street virus. और इसमें क्या होता है neighboring body is present. So street virus is also called as freshly isolated virus. इसमें neighboring body is present. So it says lab maintained virus. Lab maintained virus will not have negative values, and they are just used to prepare a vaccine. Mode of transmission is by local inoculation, that is by inhalation. That gives, if you are going in that case, then you can also get this virus infection by inhalation alone. It causes rabies, that is hydrophobia occurs, mainly due to spasm of the pharyngeal muscles. Diagnosis: antemortem and postmortem. Antemortem occurs skin biopsy from the nape of the neck, more than that from the face. तो स्किन बायोप्सी आपको मिलेगी कहाँ से? जो नेक है उसकी नेप से, हमारा नेक है उसकी नेप से स्किन बायोप्सी ले सकते हैं और फेस से भी ले सकते हैं. सो नेप ऑफ द नेक more than face. Nape of the neck is preferred site. Corneal scrapings ले सकते हैं, CSF ले सकते हैं, सीरम ले सकते हैं और सलाइवा ले सकते हैं. पोस्टमार्टम में ब्रेन बायोप्सी की जाएगी. Brain biopsy is done and we put the brain in a stain called as the Seller stain. Seller stain will show the presence of Negri bodies. This antemortem is ELISA or PCR based test, and postmortem normally it is absent. These Negri bodies, they are absent in 20% of the rabid individuals. Now vaccine. Vaccine में you will have cell culture vaccines are given. Pre-exposure में 0, 7, 21 और 28 days. Means अगर आपको कुत्ते ने नहीं काटा है और आप पहले से एक वैक्सीन लेना चाह रहे हो, in that case the type of vaccine that you can get is 0, 7, 21 and 28. 0 days पे, 7 days पे, 21 days और 28 days पे. These are the days जब आप वैक्सीन ले सकते हो. तो 0, 7, 21 and 28 days. 0 days, 7 days, 21 days and 28 days. Pre-exposure. 0, 7, 21, 28 days. Post-exposure prophylaxis में क्या है? In post-exposure prophylaxis, there is something called as SN regimen or IM or updated thigh, that is by intradermal route, it is by Red Cross. So SN regimen is for post-exposure prophylaxis is 0, 3, 7, 14, 28 और 19 days पे देनी है आपको. 0 days, 3 days, 7, 14, 28 and 19. अच्छा. SN regimen is given by IM route and it is 1, 1, 1, 1, 1 all, and the one that you obtain on the 19th day is optional. Updated thigh regimen is ID. It is given an intradermal route से by Red Cross. ये 2, 2, 2, 0 on 14th day and again 2 on 28th. ये आपको मिलती है. 0 and 3 dose if 1 year before dog bite and complete vaccination was done and again dog bite occurs. तो 1 साल पहले अगर आपको कुत्ता काट चुका है और आपकी वैक्सीनेशन कंप्लीट है एंड आपको फिर से डॉग बाइट होता है, इन दैट केस 0 डोज और 3 डोज जो डे 3 की डोज है बस वही लेनी है. प्रेगनेंसी में इट कैन बी गिवन इन एनी ट्राइमेस्टर. रैट बाइट है, इट इज नॉट एलिजिबल. Okay, but if it occurs, then you should take it as a Sarnigata as a practical aspect. If missed any dose, then add the drug to the next dose. You need to add that drug to the next. If you have missed any dose, you are going to add the drug to the next dose. Example, 7th has been missed and patient comes on 10th, then next will be on 17th. जैसे 7th डे की मिस हो गई हमारी, पेशेंट 10वें दिन को आ रहा है, 10वें दिन पे आ रहा है, तो 3 दिन ऐड करके हमको नेक्स्ट डोज जो है वो 14th डे नहीं देनी है, हमको उसको 3 दिन बढ़ा देना है, दैट इज 17th। सो दिस वाज ऑल अबाउट हमारा रेबीज वायरस। हीम एग्लूटिनेटिंग पेप्लोमर स्पाइक्स, ये पेप्लोमर स्पाइक्स हैं, ये लाइपोप्रोटीन एनवेलप है, ये आरएनए डिपेंडेंट आरएनए पॉलीमरेज है, आरएनए जीनोम मैट्रिक्स प्रोटीन। पैथोजेनेसिस दिया है, बाइट फ्रॉम अ रैबिट एनिमल इन्फेक्शन विद रेबीज, 20 से 90 दिन का इंक्यूबेशन पीरियड है। स्प्रेड ऑफ वायरस थ्रू एनवायरमेंट टू CNS, वायरस रीचेस ब्रेन, प्रोटोन स्टेज ये 2 से 10 दिन का होता है। Early symptoms include pain or paresthesia at the site of inoculation and other specific flu-like symptoms like malaise, fever, headache. First neurological signs are symptoms include cerebral dysfunction, anxiety, confusion, and agitation. Okay. Then acute neurological phase में progression to delirium, abnormal behavior, hallucinations, insomnia, hydrophobia, aerophobia, photophobia. This is the acute neurological phase. Then coma, onset of coma 0 to 14 days, and then death. Direct immunophoresis is done using monoclonal antibodies tied with fluorescein isocyanate immunoperoxidase staining can also be done. Whereas post-mortem diagnosis may be made post-mortem by demonstration of neighboring bodies in the brain. The neighboring bodies in the brain जो है they are there for post-mortem. Neighboring bodies in the brain post-mortem. Hippocampus and cerebellum. These are the two parts in which Negri bodies are abundant, so they are generally synced. Seller's technique we talked about. This is the Seller stain showing intracytoplasmic Negri bodies. There is this table I'm going to read out because this is often asked. Okay. I'm going to open the post-exposure prophylaxis का pearl in marrow. That pearl, let me check whether that is similar to this one or not. This is pearl number 1725. According to the Ministry of Health and Family Welfare, Government of India, rabies pre and post exposure prophylaxis category 1. Category 1 is touching or feeding animals, licks on the intact skin, that is there is no exposure. So this is the kind of exposure जो हम लोग almost हमेशा ही रहते हैं. The kind of exposure is this. Category 1. Touching or feeding of animals, licks on intact skin type of exposure is none. Recommended post-exposure prophylaxis is also none if reliable case history is available. Then second category is nibbling of uncovered skin, minor scratches or abrasions without any bleeding. This is the exposure. So sometimes when the household dogs they become aggressive, this is the kind of exposure that we get. So nibbling, minor scratches or abrasions without bleeding. So minor type of exposure का आ जाएगा. Category 3 is single or multiple transdermal bites or scratches, contamination of mucous membrane with saliva from the lips and contacts with bats. It is considered to be severe exposure. तो same लिखा हुआ है मैंने. Single, multiple transdermal bites or scratches, licks on the broken skin, contamination of mucous membrane with saliva, that is licks, and exposure to bats. This type of exposure is considered to be severe. Now, they have written a subscript D यहाँ पे. Post-exposure prophylaxis should be considered when contact between a human and a bat has occurred, unless the exposed person can rule out a bite or scratch or exposure to a mucous membrane. टाइप ऑफ कॉन्टैक्ट विद सस्पेक्टेड और कंफर्म रैबिट डोमेस्टिक और वाइल्ड एनिमल्स. इसमें ए है एक्सपोजर टू rodents, to rabbits and hares seldom if ever require specific anti-rabies post-exposure prophylaxis. Now the second one जो nibbling वाला था, administer vaccine immediately. Stop treatment if animal remains healthy throughout an observation period of 10 days or 5 animals is proven to be negative for rabies by reliable laboratory using appropriate diagnostic techniques. Now, administer vaccine immediately if an apparently healthy dog or cat in or from low risk area is placed under observation. The situation may warrant delaying the initiation of treatment. This observation period applies only to dogs and cats, except in the case of threatened or endangered species. Other domestic wild animals suspected as rabid should be humanely killed and their tissues examined for the presence of rabies antigen using appropriate laboratory techniques. Post-exposure prophylaxis should be considered when that we have discussed. ठीक है, पर्ल में आते हैं फिर से हम इसमें. अब देखो सस्पेक्टेड या कंफर्म्ड रैबिट एनिमल वाली जो कैटेगरी है, इफ कैटेगरी 1, 2, 3 अगर इम्यूनाइजेशन नहीं हुआ है तो बस खाली वोंड को वॉश कर दो. अगर नहीं हुआ है और कैटेगरी 1 है। कैटेगरी 2 है तो तुम्हें वुंड वॉश करना है और पोस्ट एक्सपोजर प्रोफाइल एक्सेस भी देख लेना है। और अगर कैटेगरी 3 है तो तुम्हें पोस्ट एक्सपोजर प्रोफाइल एक्सेस दैट इज वैक्सीन तो लेनी ही है, प्लस RIG भी लेना है, वुंड वॉशिंग करना है, पोस्ट एक्सपोजर प्रोफाइल एक्सेस और RIG। पोस्ट एक्सपोजर प्रोफाइल एक्सेस में ऐसे ही रेजिमेंट लेंगे जो कि 5 डेज के लिए, जिसमें 11111 करके है IM और उसमें 90th डे वाली ऑप्शनल है, तो 0, 3, 7, 14 एंड 28। और अपडेटेड थाई क्रॉस रेजिमेंट जिसमें 222, उसमें 21st डे शायद आप नहीं लेते हो, नहीं 14th डे नहीं ले रहे हो, 28 डे ले रहे हो। इट इज एडमिनिस्टर्ड ऑन डेज 0, 3, 7 एंड 28 ऑन 2 साइड्स दैट इज थाई क्रॉस। ये है हमारा पोस्ट एक्सपोजर। अगर प्रीवियसली इम्यूनाइज्ड है, अगर पहले इम्यूनाइजेशन हो चुका है तो क्या होगा? प्रीवियसली इम्यूनाइज्ड है इंक्लूडिंग PRET, तो क्या होगा? प्री एक्सपोजर प्रोफाइल एक्सेस। देयर इज समथिंग कॉल्ड एज प्री एक्सपोजर प्रोफाइल एक्सेस। Previously immunized including PRET, प्री एक्सपोजर प्रोफाइल एक्सेस आपको क्या लेना है? फर्स्ट कैटेगरी में IM और ID on 0, 7 days and either 21, 0, 7, 21 या फिर 28 days का ले लो। नाउ इसमें तो था 0, 7, 21 या 28 days कैटेगरी और वुंड वॉशिंग ही करनी है। तो प्री एक्सपोजर प्रोफाइल एक्सेस IM और ID ले लेना है। Then this is for previously immunized। और अगर कैटेगरी 2 और 3 वाले लोग हैं, दोनों के लोग हैं और लेस देन 3 मंथ्स पे, इफ लेस देन 3 मंथ्स ओनली वुंड ट्रीटमेंट, और अगर 3 महीने के बाद आपने वैक्सीन ली है तो आपको वुंड ट्रीटमेंट तो देना है, प्लस बूस्टर देना है 0 और 3 डेज पे, पर IG नहीं, इम्यूनोग्लोबुलिन नहीं देना। One intradermal dose is 0.1 ml of vaccine and 1 IM dose is an entire vial of vaccine irrespective of the size of the vial। ठीक, आपको पूरा वाइल लगाना है अगर IM देना है। Should a vaccine dose be delayed for any reason? The PEP schedule should be resumed and it should not be restarted। RIG की बात करते हैं। Provides passive immunization, is administered only once and not beyond after the initiation of PP, not beyond 7 days after the first dose of vaccine. Never be withheld regardless of the availability. Maximum doses H, RIG, ERIG 40, the IU 48. Monoclonal antibodies as cocktail containing at least 2 antibodies, RABV as alternatives. All of the rabies immunoglobulins are as much as anatomically possible, but avoiding possible compartment syndrome should be administered onto or around the wound site or sites. The remaining immunoglobulin venue should be injected intramuscularly at a distant site from the site of vaccine administration. Rabies may be immunoglobulin may be diluted to a volume sufficient for all wounds to be effectively and safely infiltrated. Priority rabies are multiple bites, bites to the head, neck, and hands in patients with severe immunodeficiency. The biting animal is confirmed or probable rabies, then bites, scratch, pre-exposure. बच्चों को एंटेरो लार्वल पार्ट होते थे, but not in the gluteal area. Please don't give rabies vaccine in the gluteal region. जिनको याद नहीं उनको फुल ट्रीटमेंट देना है। चलो, देयर आर 5 MCQs, लेट मी सी। Zero by 30 is the global strategic plan to end human death from dog-mediated rabies by 2030. It is appropriate to give post-exposure prophylaxis immediately to reduce the chances of getting rabies by administering cell culture-derived vaccine. बस पूर्ण ट्रीटमेंट करना। So with this, we completed our rabies. Okay. Moving on to hepatitis. I think doing hepatitis is painful or okay. The good thing is only hepatitis is long enough, otherwise सब हो गया है. Sorry, let's do hepatitis. If no problem, then we can do these viruses. Hepatitis virus. Hepatitis virus में cases हैं हमारे पास. 40-year-old woman who had received multiple blood transfusions over the previous 6 months presented with persistent fatigue, loss of appetite, nausea, vomiting, abdominal pain for a duration of 10 days. So 10 दिन से nausea, vomiting when all these things are there. She had history of passing high colored urine. So colored urine pass कर रही है this female. Her liver function test showed elevated serum urine. She had a history of passing high colored urine. Her liver function test showed elevated serum bilirubin and also liver enzymes. So serum bilirubin is elevated. Liver enzymes are also elevated. A viral hepatitis panel was advised and showed HBsAg positive है. Anti-HBc IgM positive है. HBAg positive, anti-HBc IgM positive मतलब अभी acute infection है. And anti-HAV IgM negative. Okay, HAV नहीं है. Anti-HCV IgM negative again. कोई भी HCV infection नहीं है. Acute HPV, yes. Placed on supportive therapy, and the liver enzymes and viral markers monitored every month to check for seroconversion from HBsAg to anti-HBsAg positivity. Every month monitors किए गए to check for the seroconversion from HBsAg to anti-HBsAg positivity, indicative of resolution of the disease. HBsAg to anti-HBsAg positivity. So, moving on to this. सबसे पहले 6 टाइप्स के होते हैं A, B, C, D, E. F नहीं होता है, there is only G. A is what? Picornavirus. Hepatinavirus is B. C is flavivirus. D is RNA defective delta virus. E is calcivirus and F is flavivirus. These are all RNA viruses. Only B is DNA virus. So the pneumonic is private hospitals favor which clients forever. Private is for the coronavirus, hospitals is a coronavirus, flavivirus, RNA defective delta virus, client is calcivirus and pneumonic is flavivirus. Now hepatitis A. Hepatitis A की बात करते हैं तो क्या होता है कि hepatitis A is going to cause infectious hepatitis, fecal-oral transmission. Incubation period is 0 to 6 weeks. LFT will be deranged, सब कुछ बढ़ल हो जाएगा. And it is only hepatitis virus that can be cultured is hepatitis A virus. Self-limiting and there are outbreaks as well. IgM, ELISA and PCR can be done. Vaccine can be live attenuated or killed vaccine that can be given. Quickly watching the hepatitis A virus के related चीजें. This is the electron micrograph of a 27 nanometer hepatitis A virus aggregated. Earlier it was called as enterovirus 72. Immunological and biological events associated with human infection with hepatitis A virus. There is this diagram. Relative concentration of anti-HAV. This is the weeks after exposure. So 2 weeks. We said that it's from 2 to 6 weeks. IgG उसके बाद आएगा 4, 6, 8, 10, 12. ये वायरस है ब्लड में. This is the virus in feces. This is aminotransferase. फीसीज में वायरस 2 से 6 वीक पे दिख जाएगा और ब्लड में 2 से 4 वीक पे. अमाइनोट्रांसफरेसेस 4 से 8 वीक में और जो जॉन्डिस के सिम्टम्स हैं 4 से 6 वीक्स में. हेपेटाइटिस बी वायरस. Enterically transmitted NANB or epidemic NANB hepatitis. So it is also called as NANB, that is non-A, non-B. Epidemically and enterically. ये किसको बिलोंग करता है? कैल्सी वायरस फैमिली को बिलोंग करता है. पीको ओरल रूट है इसका ही. माइल्ड acute hepatitis, but it causes fulminant hepatic failure in pregnancy. Mortality increases by 20 to 25%. Mortality increases. फिर और आपका hepatitis B virus, it causes क्या? Causes serum hepatitis B virus causes serum hepatitis. केस हमने पढ़ ही लिया था इसका. यहाँ पे incubation period is not 2 to 6 weeks, but it is 2 to 6 months. There is a huge level of difference in this. Sexual blood transfusion, mother to child transfusion and needle sharing. So that is sexual transmission. So, okay, blood transfusion, mother to child and needle sharing. So sexual transfusion. Sexual mother transfusion से होगा. Blood transfusion से होगा. Mother to child sharing of needles, these are the common modes of transmission. So sexual, blood, mother to child, needle sharing. Sexual, blood, mother to child and needle sharing. These are the methods of transmission. Sexual transmission, blood का transfusion, माँ से बच्चे में और needle की sharing से होगा. These are the methods or modes of transmission of this virus. DNA virus is a partial double-stranded DNA virus that has an icosahedral symmetry. It is enveloped and there are 42 nanometer size का ये होता है. So 42 nanometer size is the complete virus is known as the brain particle. ऐसे होता है. enveloped icosahedral partial double-stranded DNA. Needle sharing से सकता है mother to child sexual blood transfusion. 5 genes से S gene is HPS is surface antigen. Australia antigen इसे कहते हैं S. C is HPCAG, that is the core, and 3C is HPE, that is the enveloped antigen. Pol gene is associated with enzymes, and X gene is associated with the regulatory functions. Now, the serology in hepatitis B virus, I'm going to discuss later. I'm taking a break, and this break will be a little long because I'm going for dinner. So, taking a 30-minute break over here. We will come and discuss the serology and also paracetamol in the subsequent period of time. Thank you so much.